Hello, and thank you for joining me today. My name is Dr. Scott Huffman, and I am the Associate Medical Director for the Orange County Healthcare Agency Substance Use Treatment Program. During this training video, I will discuss changes to involuntary holds, also known as 5150s, that are addressed in Senate Bill 43 and will go into effect in Orange County on January 1st, 2026. This high-level training is specifically designed for you as our first responders, and the intended audience includes law enforcement, fire department personnel, and ambulance EMTs and paramedics. Let's get started. This is Module 1 of the SB 43 training, in which I will review what is SB 43, what defines a severe substance use disorder under this new law, what are the observable considerations in the field that may suggest an individual is experiencing a severe substance use disorder. We will discuss the concepts of personal safety and necessary medical care, and I will also introduce you to the SB 43 Quick Pocket Guide. After completing Module 1, please be sure to review Module 2 that will cover some scenario-based examples to support our understanding of these changes under SB 43. This training and the materials that we will be reviewing have been specifically designed for first responders, such as law enforcement, fire personnel, and EMTs and paramedics. Input into the content and structure of this training was obtained from our Orange County SB 43 First Responder Planning Committee, which is a subgroup of the Orange County Crisis Intervention Team, or CIT, steering committee, which consists of professionals from our law enforcement and fire and EMS partners. Recommendations from this group included a video-based training format, including this video that you are watching now, scenario-based case-based examples, and a summary pocket guide for easy reference and use in the field. This new law, as indicated by the bold text on this slide, expands the definition of gravely disabled to include 1, people with a mental health disorder and now a severe substance use disorder, or a co-occurring mental health disorder and a severe substance use disorder, and includes those who are unable to provide for their basic needs for food, clothing, shelter, or now are unable to maintain their personal safety or to access necessary medical care. We will talk more about a severe substance use disorder, personal safety, and necessary medical care on the upcoming slides. To expand on the concept of a severe substance use disorder, and specifically how it will apply to the role of first responders, I will discuss the definition of a severe substance use disorder according to SB 43 and the expectations for first responders, and especially for designated law enforcement personnel. A severe substance use disorder is defined as a diagnosed substance-related disorder that meets the diagnostic criteria of severe according to the most current version of the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5-TR, at the time of evaluation for an involuntary detention. However, DSM criteria for a severe substance use disorder can only be assessed for and determined by licensed clinical staff. Non-clinicians who are LPS designated to place involuntary holds, including law enforcement, are not expected to make a DSM diagnosis for a substance use disorder, but simply need to describe the observable behavior or conditions that justify a 5150 hold for a severe substance use disorder. These observable behaviors and conditions should include and be consistent with the DSM criteria and should meet probable cause for detaining an individual due to grave disability because of a severe substance use disorder. We will discuss examples of observable behaviors and conditions for use by law enforcement on the upcoming slides. We thought that it would be helpful for some context in our discussion of a severe substance use disorder to present the DSM criteria that are used by licensed clinical staff to assess for and determine a substance use disorder. A friendly reminder that these criteria are only to be used by licensed clinical staff, and instead for law enforcement and first responders, we will be focusing on looking for observable conditions and not DSM criteria in determining if an individual should be placed on a 5150. Again, we will be talking about these observable conditions on upcoming slides. Under SB 43, the expanded criteria for grave disability now includes reference to personal safety. This is in addition to the existing criteria for grave disability of neglecting food, clothing, and shelter. Personal safety means the ability of one to survive safely in the community without involuntary detention or treatment pursuant to the LPS Act. This concept may sound fairly broad, and we will cover some examples for concern of personal safety on the next slide and then the cases in Module 2. Indications of grave disability for personal safety. The following are examples of observable conditions for neglecting personal safety. This is not an exhaustive list. One incident alone would not automatically meet the standard to detain a person. These examples must be significant and severe enough to cause serious bodily injury or death and must be related to a severe mental illness or severe substance use disorder and not due to certain medical conditions such as dementia or reflect a deliberate lifestyle choice. Examples include placing oneself in harm's way in traffic that risk their own life or those of others, an individual incapable of defending themselves against ongoing victimization due to a lack of awareness of their vulnerability, severe impaired judgment resulting in risky situations that threaten the person's own life or those of others, unhygienic or uninhabitable living conditions or behaviors which are so severe and significant to contribute to an unsafe physical environment. Poor hygiene alone and or being unhoused is not sufficient. Repeated severe substance use that is medically life-threatening, for example, multiple near-fatal overdoses requiring medical intervention. Other examples of observable conditions will be listed on the field quick guide and may include home safety issues such as not attending to appliances like leaving the stove on due to intoxication or mental health symptoms, the inability to care for hygiene and cleanliness, which could or has led to illness, or hoarding to an extreme, causing safety concerns or hazardous or dangerous conditions. The second concept of the expanded definition of grave disability under SB 43 references necessary medical care. Necessary medical care means care that a licensed healthcare practitioner, while operating within the scope of their practice, determines to be necessary to prevent serious deterioration of an existing physical, medical condition, which, if left untreated, is likely to result in serious bodily injury, as defined by the Welfare and Institutions Code listed on the slide. Let's talk more about necessary medical care. The following are examples of observable conditions for neglecting necessary medical care, and this is, again, not an exhaustive list. These observable functional impairments must be resulting in a serious deterioration of an existing physical medical condition, which, if left untreated, is likely to result in serious bodily injury or the person's inability to survive safely in the community without involuntary detention or treatment. Behaviors may be exhibited as a perceived mental health or severe substance use disorder condition by those in the field screening for grave disability. Examples include signs of significant malnourishment, loss of weight or dehydration, which puts the individual's life or long-term functioning at risk, perceived cognitive and or emotional impairment resulting in a lack of decision-making capacity to pursue medical treatment for life-threatening conditions in the moment, including but not limited to, say, inability to utilize medical care when needed and available, or wound care and infection issues that are likely to lead to loss of life or limb if not treated. Other examples of observable conditions will be listed on the field quick guide and may include uncontrollable vomiting, diminished responsiveness or loss of consciousness, potential loss of limb due to an untreated condition, uncontrolled bleeding, coughing or vomiting blood, cold, clammy skin, seizure or convulsions, complaint of severe pain or severe injury, non-healing wounds, wound care or potential infections, or extreme or profuse sweating. We are all aware that these signs and symptoms present frequently on the scene of many 911 calls and crisis responses. But remember, the goal is to observe for conditions that could suggest the presence of a severe substance use disorder. This is not a simple checklist to establish criteria for grave disability, but rather this should prompt us to look at the whole individual and other known information about their circumstances that, when considered in total, could suggest a severe substance use disorder and or a mental health condition. In other words, we aren't simply looking for uncontrollable vomiting and or cold and clammy skin, but do we see these signs along with other circumstances to suggest a severe substance use disorder? This could include drugs or paraphernalia at the scene, or the individual making reference to drug use. It is important to note that in order to establish grave disability for an involuntary hold, there needs to be both the cause and the effect. The cause being the mental health and or severe substance use disorder, and the effect being danger to self or danger to others or grave disability as outlined on the slide. As you can see, SB 43 is not a comprehensive solution or evidence-based practice to address all aspects of homelessness or substance use. It is simply another tool in your toolkit to evaluate an individual for an involuntary hold or civil commitment for an expanded yet still focused set of criteria. SB 43 was not meant to address all individuals with substance use disorder, and it is instead focused on severe substance use, severe impacts suggesting that one is gravely disabled and they are unable to access services and care on a voluntary basis. Let's briefly discuss where individuals can be further evaluated under the new criteria of SB 43. Clients on an involuntary hold can receive evaluation at any of these sites dependent upon the individual's particular circumstances and especially in consideration of any accompanying medical conditions. Currently in Orange County, there are crisis stabilization units or CSUs and emergency departments that can receive individuals on a 5150 involuntary hold and who need evaluation and possible treatment. The healthcare agency is also working with CSUs and emergency departments to expand training and staffing requirements and the capabilities to receive and provide care to individuals with a severe substance use disorder. In order for first responders to see the number of available beds at each CSU, the Orange County CSU Bed Board can be accessed at the link on the slide and shows census numbers in real time. If individuals have accompanying medical issues, first responders can take individuals to our designated emergency departments. These include Huntington Beach Hospital, Anaheim Community Hospital, Mission Hospital Laguna Beach, St. Joseph Hospital, UC Irvine Medical Center, Anaheim Global Medical Center, Chapman Global Medical Center, Orange County Global Medical Center, or La Palma Intercommunity Hospital. And if an individual has immediate and urgent medical needs, first responders can transport the individual to any of our nearest local emergency departments, or in other words, the closest facility. This is similar to the current practice with individuals who are on an involuntary hold for mental health criteria and have urgent life-threatening medical needs. This tool is the quick pocket guide for our first responders and law enforcement in the field. This pocket guide fits nicely into the shirt pocket for quick and easy reference, and it outlines the observable considerations for grave disability as well as a severe substance use disorder. And it includes examples of neglecting personal safety and necessary medical care that our first responders may see in the field. When considering an involuntary hold, the first responder or law enforcement should observe the collective presentation of these considerations that may indicate grave disability due to a severe substance use disorder or mental health condition. Remember, grave disability does not simply result from one or two observable considerations, but rather we are looking for how these observable conditions relate to the cause and effect, as we discussed earlier, the cause being the mental health condition and or severe substance use disorder, and the effect being the danger to self or danger to others or grave disability. And also remember that grave disability now speaks to the inability to tend to personal safety and or necessary medical care. So this is in addition to the existing elements of neglecting food, clothing, and shelter. A note that this quick pocket guide should only be used in conjunction with completing the SB 43 First Responder Training Modules 1 and 2. So just to review, Please remember that you are focusing on looking for observable conditions of a severe substance use disorder. Again, many examples are listed on the field pocket guide, but we cannot rely on just one example or a set number of observable conditions. This slide highlights the scenario of signs of intoxication, slurred speech, smell of alcohol, and bloodshot eyes, as not necessarily meaning that a severe substance use disorder is present. We are looking at the big picture and for the presence of severe impacts of a substance use disorder leading to grave disability, such as multiple contacts of incapacitating intoxication over a 12-month period, refusing to use food, clothing, shelter when offered due to a severe substance use disorder, unable to care for personal hygiene, cleanliness due to a severe substance use disorder, or repeated medically life-threatening substance use such as multiple overdoses. Law enforcement are identifying observable conditions of a severe substance use disorder and not determining DSM criteria for a clinical diagnosis. Lastly, to prepare for the launch of SB 43, the healthcare agency developed a new Orange County SB 43 website. The link is listed on this slide, and the website will house all of the content on the slide, as well as a message from our behavioral health director, the SB 43 first responder training videos, the SB 43 field quick pocket guide, and we will also add frequently asked questions, including those based on the questions that are submitted through the SB 43 email box as well. We'll also include any other changes or updates to the legislation or regulations of SB 43. And lastly, the SB 43 bill text itself will also be posted for reference. We also created a new email box for any SB 43 inquiries, questions, or feedback for our county and contracted partners, our community organizations, and anyone else impacted by the new law. Responses will be provided to individual inquiries promptly. Commonly asked questions will be added to the frequently asked questions on the website, those mentioned on the previous slide. Thank you for listening to Module 1 of the SB 43 First Responder Training, and I look forward to speaking to you in Module 2, which discusses cases and scenarios relevant to SB 43. And a final note and reminder that if you or a loved one needs help or assistance with mental health or substance use, please consider contacting OC Links at 855-OC-LINKS as listed on the slide, or one may also chat one-on-one with a professional on the OC Navigator website at ocnavigator.org. Both services are staffed by trained behavioral health professionals who can provide information and resources on treatment and are also a pathway to the services of the county's mobile crisis response team. Thank you again for joining today.